Well, but thanks, Bill. I want to add my welcome on this final day of the OBSSR 20th Anniversary Symposium, and indeed I would say this is a celebration of behavioral and social science research at NIH. It's a fundamental part of what we do. I know, as others have noted, the office opened officially on July 1st of 1995. And the U.S. Congress established the office directly in the office of the NIH director, and that was to recognize the foundational role that behavioral and social factors play in contributing to illness, but I think more importantly also in the promise of improving health. The OBSSR mission is to stimulate behavioral and social sciences research throughout NIH and to coordinate and help integrate these areas of research into the broad and diverse topics of research pursued in each of our NIH institutes and centers so that behavioral and social science perspective can help in improving our understanding, treatment, and prevention of disease. Personally, in 2006, OBSSR joined a set of trans-NIH offices located in the Office of the Director, again, at a congressional request, to create the Division of Program Coordination, Planning, and Strategic Initiatives. And Bill's been with us acting for a year, and I congratulate him on memorizing the title of the division. It's a task that sometimes I think our director is challenged by. So we call it DPCPSI for those of you from New York. The division includes offices devoted to coordinating other or similar broad fundamental areas of trans-NIH research, such as women's health, disease prevention, very broad areas of our research infrastructure, including the resources that support animal models, and including the non-human primates, very important for behavioral social science research, and also the Office of AIDS Research, and the office that's responsible for the Trans-NIH Common Fund. So I've been at NIH for almost 5 years now, overseeing the division that contains these offices, and it's been very gratifying to me to help them, nudge them, push them into finding ways to share their perspectives and to synergize in achieving their missions. For example, our office directors, Bill, included often co-plans workshops with our other offices and funding opportunity announcements. And I think these offices have very strong behavioral and social science bent to them, and we're really becoming more effective by all working together. So that's been very gratifying, and Bill's just been super in participating in that. There are obviously many shared goals for behavioral social science research with women's health, disease prevention, AIDS, and I'll give you a specific example. OBSSR played an absolutely key role in 2 of our behavioral and social science efforts supported by the Common Fund. These are the PROMIS patient-reported outcome measure systems, and specifically the Science of Behavioral Change program, which is active now. And again, it's just been a great pleasure for me to work with the previous director, Bob Kaplan, and now the acting director, Bill. So welcome to this celebration of the achievements and the continued and future central role played by OBSSR and behavioral science research at NIH. It is now my distinct honor to introduce my colleague, the Principal Deputy Director of NIH, Dr. Larry Tabak. Larry moved to the Office of Director in 2010. Previously, for 10 years, he had been the Director of the National Institute of Dental and Craniofacial Research. He has been, I will abbreviate this, he's been really fundamental in a number of our major trans-NIH behavioral social science activities. He led the first roadmap program that attempted to learn the lessons for doing group science, team science. That's extremely important. He's led our most recent diversity in the biomedical research workforce. You know, he's a very accomplished researcher, continues to be a past merit recipient, a member of the Institute of Medicine. And I want to end by saying, you know, Larry's like the super dean or something of NIH. In his role, he deals with everybody and every issue. And so I like to think of him as the psychologist in chief of the NIH. Larry?